Hey, if you hadn't heard the news, UAMS Health has launched a walk-in clinic that provides expert care for orthopedic patients ages 12 and up. It's called OrthoNow. Dr. Sean Parham is an orthopedic surgeon who concentrates on foot and ankle injuries. He is here now to tell us how we can bypass that long wait at the emergency room. Doctor, thank you for being here.
Thanks for having me.
Great to see you. This is such a brilliant idea because, as I just mentioned, you know, if you have an ortho injury, and they happen at all times of the day, normally we have to consider going to that emergency room where we may not be seen by a doctor for a very long time.
Yeah, I mean, if you look at the stats, 70% of all primary care visits are musculoskeletal related complaints. It's not just the ER, it's your primary care physician. We're just inundated with this amount of injuries. And so for us to open this clinic to give people another place to go has been such a game changer for them.
Well, you know, the emergency room or even those primary care facilities, a lot of times these doctors, God love them, they're drinking out of a fire hose all the time, right? But you can go right to the guy who specializes in what's wrong with you.
Yeah, you know, absolutely. When you go into the ER, a lot of times it's a cold, it's chest pain, it's belly pain. It could be a lot of different things. Your GI doctor, urologist, whatever you may need. But when it comes to what we do, hands, feet, hips, and knees, you know who you need. You really need an orthopedic surgeon. And that's the thing, you walk into this clinic, that's who you're going to get from the get-go.
Yeah, I mentioned to you earlier that I have two teenage sons who've had athletic injuries, and we really did not know where to go. And this is the perfect situation for that. Because, you know, again, you're not just open during office hours. Talk a little bit about that, because these sports games happen in the evenings, at night.
Well, that's the thing is, you know, as much as I wish life would stop when you have an injury, it doesn't. You still got to go to work. You still got to have life. And for kids, their ball games are in the evening. You know, wait all night to the next morning, hope you can get in, or you're going to go wait and sit in the ER all day. It's really that 4 to 8 p.m. shift that I think makes such a big difference for our patients to come in to be seen, so they don't have to take time off, they don't have to make any special arrangements, and we're there for them.
And you've got Saturday hours too, right?
We do. Every Saturday from 8 to noon, so we even have weekend time as well, that, you know, those Friday night light injuries, come and see us in the morning.
That's right. And sometimes the injury you get at night, you may think it's going to be okay, and by the morning, we really got to see somebody.
Black, blue, swollen, can't stand on it, absolutely.
Well, you would know all about black, blue, can't stand on it, because your ankles and feet, and you were telling me that this is really the majority of what you see at the walk-in clinic.
Absolutely. I mean, our feet are how we interact with the world. It's how we get around, how we get from place to place, even inside our own home, you know? And so one of the things that we see all the time is, I'd probably say about 50% of what we see at Ortho Now is feet and ankle-related conditions, just stubbed toes, sprained ankles, ankle fractures, all of the above, just because it's so frequent that we miss something in the world that causes us a problem.
Yeah, oh, no doubt about it. Well, I want to talk about the hours, again, just to be specific, because we were kind of broad there. Oh, that's a gorgeous picture right there. Yeah.
Really a wonderful facility that we have. I mean, we've just been truly blessed to the facility that you have and how beautiful it is, but it's the people inside of it that really make the difference.
Yeah, no doubt about it. You mentioned foot and ankle injuries, but there's a lot of advancements in how you treat these days, isn't there?
Absolutely. I mean, you know, there's so much from what we used to do, where a lot of fractures used to be just treated with casts, and now we know, hey, you're really not going to get the best benefit with that. And so that's why it's important to come and talk with us about what the newest things we have are and whether surgery really is the right answer for you.
So what are some of the answers if it's not a cast or a boot?
Yeah, you know, they're just making that clinical decision making on certain fractures is, you know, the data is changing. We have new literature, new imaging modalities, and everything like that can help us guide, like, hey, we used to treat this without surgery. We know people really don't do that well in the long run, but now we know surgery is a good answer, and getting the most updated information to our patients is really key and critical.
And the goal is always to get people back to their normal lives as quickly as possible, right?
Absolutely. Well, quickly and effectively. I want you to get back and feel like you never had your injury in the first place. That's my biggest thing.
Well, and one of the first steps to be able to do that if you're injured is to come to a place like OrthoNow. Again, the hours are Monday through Friday.
Yep, Monday through Friday. This is 8 a.m. to 8 p.m. So all days, 12 hours, come in and see us. And then Saturday, we have 8 a.m. to noon as well. Staff full-time, imaging, x-ray, everything you need. And say you need something else like a CT scan or an MRI, it's in the same facility. Most times we can get it the next day.
Yeah, and that's exactly right. And you can get the people to the places they need to be quicker by having, again, the first doctor you see is the specialist.
Yeah, it's one of the biggest troubles with modern medical care is people trying to switch systems, and everything that we have is in-house. You come in with your hand injury, maybe it's not me treating it, but I know who is, I know how to get a hold of them, and I can get you in.
Dr. Parham knows a guy.
I know a lot of them.
You know a lot of them. Well, we're grateful you are here. Dr. Sean Parham, thank you so much for
Thanks
coming
again
in.
for having me.
OrthoNow is the place to go if you need orthopedics attention on your time. Go check them out. Be back with more Good Morning Arkansas right after this.